Hey everybody, welcome to this week's Ask Dr. Dan. This week we're going to be talking about hair restoration. As you know, hair loss is very common in both males and females. The most common form of hair loss is what we call androgenic alopecia. What that means is it's due to hormones. So in men, it's a conversion of their testosterone to something called dihydrotestosterone. And basically what happens is the dihydrotestosterone in the hair follicles puts the hair in a dormant state, which over time makes the hair cells shrink and become less pigmented and then eventually shed. Male pattern baldness is very common. First it starts in the front and we start getting that receding hairline, and then the crown starts thinning as well. In females, it is also related to a conversion of testosterone to dihydrotestosterone, but we also think that it's related to loss of estrogen, as female baldness is much more common postmenopausal. The way females lose their hair is a little bit different. They lose it in the part, and then that part starts to extend. So it's not quite as noticeable in most women because you can hide that. What we typically do for hair restoration is PRP, or platelet rich plasma. We've talked about PRP before for use in injuries such as chronic tendon, ligament, joints, but it also works in the scalp. And the way it works is every hair follicle has stem cells that actually help promote the hair growth. These stem cells become dormant with the loss of hair, and basically what the PRP does is the growth factors in the platelets actually stimulate those stem cells and start getting hair growth again. This even works for other types of hair loss like alopecia areata or telogen effluvium, which are more stress related. They're typically temporary anyway, but this can help speed up the process of hair regrowth. We typically combine the platelet-rich plasma with other treatments, such as possibly things like minoxidil or different supplements that also help with stress and hair nutrients. And the way we give the platelets is by injection. So what we do is we do multiple injections into the scalp, and then we also use a little microneedling to just kind of get that whole area. It typically takes about 12 weeks to really start noticing growth of hair. And then we will sometimes need to do more than one treatment if needed. We'll also test your blood work to see if there are any other causes, things like thyroid issues or vitamin D, that can contribute to the hair loss. And if we don't treat those, even with the PRP, you might not get the results you're looking for. So we're going to be taking your questions over the course of the week, and then we'll get your answers on Friday. So I hope you all have a great week, and remember, don't operate, regenerate.